Thank you for being with us this evening. My name is Louise Halfpenny and I'm the Director of Communications at West Herts Hospital's NHS Trust. And we are here this evening to talk about Your Care, Your Views, which is our public engagement programme. And over the course of this evening, we hope to talk to you about the rationale for our proposals and particularly to highlight surgery. I will shortly be introducing you to two of my clinical colleagues. A couple of rules about this evening. Your microphones will be muted and we ask you please to keep off camera, which helps us with our bandwidth and just makes for a slightly easier presentation for us. So thank you very much for that. We will have questions, and if you can send them please to West Herts Communications. If you can keep them to the topic of this evening's presentation, that would be great. I may paraphrase if I spot that there are 2 or 3 questions that are very similar, and I will do my very best to get through all of your questions this evening. We are recording this session and we will post this session on YouTube afterwards, so probably tomorrow or later in the week. So it will be there for you to look at or for anyone else to look at afterwards. So as I outlined, the aim of the session is to talk you through the proposals about how we expect to work across our 3 hospitals, and particularly looking at St Albans City Hospital and surgery this evening. It's very important that we do get your views, so please do ask questions, type them in as soon as you think of them. And also, if you would be kind enough to tell other people that we are running these sessions, that would be great, because we really want to reach as wide an audience as possible. So some of you may have been following the story of our proposed redevelopment for years now, because it has been rumbling on for quite some time. But in case you haven't, there's a little bit of background here. We've been working very closely with our main commissioner, that's Herts Valley's Clinical Commissioning Group, to secure funding for major redevelopment of our 3 hospitals. And those are Watford General, St Albans City Hospital and Hemel Hempstead Hospital. In 2019, the Prime Minister Boris Johnson announced that we were one of 6 trusts to receive funding via the Health Infrastructure Plan, and that is merging into a new name, the New Hospitals Programme, and we remain one of the front runners. There are now 8 front runners and we are one of the front runner trusts. In order to secure our funding, unfortunately, it's not enough for the Prime Minister just to stand up and say we've got the money. We have to do quite a lot of legwork to get our hands on the cash, and that's currently what we're doing. We're developing our proposals, and then we have to prove that they are best value and that they are good for our patients. And we have to do that to our regulators, NHS England, NHS Improvement, Her Majesty's Treasury and Department of Health and Social Care. So quite a lot of work to be done, and we hope to have buildings open in 2025 or soon after. Now, the building is actually going to happen relatively quickly, we would suggest, because a lot of the component parts will come in prefabricated. So the build itself is fairly quick. It's the length of time to get to the build point, appointing contractors and going through the approvals process that can take the time. And as I was saying, it's really important that we do have your views. The ideas and the proposals that you hear tonight, they haven't been put together by a few managers in a darkened room. They are absolutely from the minds of our clinicians. They have been thought through. They have been designed by people who are ambitious for their services and for your care as our patients. We have used some national strategy and some local strategy to inform our thinking, and that will come up in tonight's session. But if you want to find out more about the strategic background to what you hear tonight, please do look on our website. You can read our clinical strategy. It has a more pragmatic and longer length document, the clinical brief, and that will really tell you where we expect services to be delivered from. And there are 2 engagement documents, a shorter one and a longer version. So we hope we've given you enough options depending on how much you want to read. So we have a saying, three's company. We don't think three's a crowd. We're very happy with the way that our 3 hospitals could work together. So our model broadly is for Watford to remain as the locus for our emergency, specialist and complex care. St Albans for planned surgical care, planned cancer care and an urgent care service. And we've got a little asterisk there just to highlight the fact that the minor injuries unit is temporarily closed due to the pandemic, but we hope to deliver an urgent care service when that reopens. It will be slightly different. And Hemel Hempstead is where we want to provide our planned medical care and long-term conditions, and there will also remain urgent care services. The main ethos, or one of the sort of key strands of thinking behind our plans, is to consolidate and not duplicate. So where services are currently provided across 3 sites, it is likely we will provide them across 2, and in some cases from 3 to 1. And the reason for this is to really ensure that our clinical teams can be based together in slightly higher numbers, and this is so that they can give better support to each other. This will help avoid cancellations when there is staff absence. It will be really good for team working, ready access to training and development opportunities and to senior clinical opinion. And it will also help us make better use of the diagnostics that we want to underpin a lot of the changes that we're talking to you about tonight. I should just say, sorry, before I hand over to Ben, I should just say that our changes do mean that the service that you, or the hospital nearest to you, might not be the best hospital for you to go to. So there will be a difference between what is most local and what is most appropriate. And so that might be a change for you. If you live in St Albans, but you have long-term condition, you would go to Hemel Hempstead, and if you live in Hemel Hempstead but you have need for planned surgery, you would most likely travel to St Albans. So that's just an important point to bear in mind, and it's really about putting quality and safety slightly above geography in some cases, although there will be a commonality. So some outpatient services will be provided across all 3 sites, those that are most commonly used. So I'm now going to hand over to Mr. Ben Rudge, and Ben is a consultant orthopaedic surgeon. And Ben, I'm right in saying I think that you're also the clinical director for orthopaedics. So thank you very much for being with us this evening, and over to you. Thank you.
Thanks, Louise, and thank you for asking me. So yes, first of all, an overview of the services that are currently provided at St Albans, and then the thoughts for the future. So today we'll be talking about the outpatients and the diagnostics, and then also the planned operations and procedures. I think there's already been a meeting about cancer diagnostics and treatment, and Louise, you've already mentioned the minor injuries unit that is, again, thoughts for the future. Next slide, please. So services currently at St Albans. The outpatient clinics, this includes breast service unit, the orthopaedic unit currently in its entirety, ophthalmology, maternity and obstetrics, and adult outpatients, and then some other facilities such as renal dialysis. And with regards to surgery, St Albans is the site for all planned surgery, emergency surgery being at Watford, planned surgery at St Albans. So that's where we have our operating theatres, inpatient wards, day case unit. It's where the majority of elective, as in planned orthopaedic surgery, happens. We do a small amount at Watford in certain instances, and the vast majority happens at St Albans, alongside all the pain and ophthalmology surgery services. Next slide, please. So the NHS Long-Term Plan from 2019 talks about areas around improvements to surgical care and outpatients, and this issue around separating urgent services from planned services, which can definitely make things easier in terms of running efficient surgical services. But it also talked about planned services being provided on a cold site where capacity can be protected to reduce the risk of operations being postponed at the last minute if more urgent cases come in. And so for us, the obvious thing where that happens is at Watford in the winter with the bed pressures. It makes it very difficult to continue to run the planned service. So as much as possible, separating planned surgery into a separate unit is a positive. This long-term plan also talks about managing complex urgent care on a separate hot site, allowing trusts to provide improved trauma assessment and better access to specialist care. So that's a viable option too. This has formed the basis of what we'll come on to now. So on to the next slide, please. So we've considered a range of potential options for the future about planned surgical care, about whether it could be on a separate site or the same site as emergency care. There are definitely benefits, or some benefits, to having planned surgery on the same site as the acute service, where you've got every single service under the sun. But then there are real benefits to separating it. If you separate the services, you can run a specialist setting and give the best possible care in a suitable environment without the distractions, for want of a better word, of the pressures on the acute site. So you enable a planned surgical site to run independently. And whilst we have that to a degree already, with most non-complex planned surgery currently happening at St Albans, we have theatre capacity constraints and workforce constraints, and the lack of some diagnostic facilities which have limited the amount that we could do at St Albans. So as an example of that, for instance, if you have surgery on your neck, you need to have that surgery done in the facility where there's an MRI scanner. And when we don't have an MRI scanner at St Albans, that means the surgery has to happen at Watford. Simon, I don't know if you want to come in now. Simon is the Divisional Director for Surgery Anaesthetics. If you want to take on the next slide. You're muted.
Sorry. So our plans really are to improve the theatre capacity that we have at St Albans at the moment. We currently have 6 theatres. The longer term plan is to improve those. And to complement this, we're also going to improve the diagnostic services that we have on the St Albans site, so that we have a diagnostic suite, which we don't currently have. And this will allow us the ability to plan and carry out comprehensive planned surgery and cancer and rapid diagnostics as a base for our patients. St Albans will become our main cancer diagnostic site, encompassing those cancer services that we currently offer, but concentrating them within the St Albans site. It'll allow those patients to have more rapid access and an ease of access to those services without having to need to travel around sites. So currently, some of our services are in Hemel, some of our services are in Watford, and some of our clinic spaces are actually ran through the St Albans site. So patients could actually end up travelling between 3 different hospitals, but only having to see one specialty in 3 different sites. The long-term plan with the new development is to move our endoscopy facilities, which are currently at Hemel Hempstead, to the St Albans site. That's because the Hemel site is restricted both in size and needs significant improvement. And that would allow those endoscopy services to be co-located to either the surgical centre or the cancer diagnostic centre. That decision yet to be made. Another huge benefit of consolidating the planned surgery and cancer care is it will also allow us to decompress the Watford site. Yes, there is some consideration to be given to long-term plans with respect to Mount Vernon, but those aren't really our plans to make. Next slide, please. So there is a significant opportunity to improve outpatients. It'll allow us to, on the face of outpatients as a whole, change the way that we work within the outpatient setting. So it allows us to be working both with our partners as well as with primary care. It will allow us to have more one-stop service. So the co-location of the diagnostic centre with outpatients and including the endoscopy could allow our multidisciplinary clinics to be undertaken in one setting and at one sitting. As we move into the future, we are going to have more patient-initiated follow-up. And as you saw from Ben's slide about the Nhs Long-Term Plan, there is a move towards virtual clinics. So general practitioners and the NHS as a whole have been tasked with reducing the number of face-to-face appointments. And we anticipate reducing our face-to-face appointments by up to a third, should patients wish that model to be how they go down their treatment lines. It'll also allow us some remote monitoring from the clinical nurse specialists and other services that we will develop in the new hospital site. With the new hospital, we would be able to have an adult surgical outpatient service space in one site. And whilst, as Louise has said, it may mean that you would have to travel to a different hospital that isn't necessarily critically adjacent to where you live, it would be concentrated in one site and mean that all of your services for your surgical visit and pathway could be undertaken in one place at one time. As we said, by co-locating that with our cancer services that we currently deliver, it'll allow us to enhance the one-stop patient pathway, and that goes in hand with the endoscopy unit being on the same site. And the improved diagnostic facilities play into that as well. Next slide, please. So by moving ENT, general, colorectal and vascular surgery onto the St Albans site, we'll be able to increase our consultants' presence in St Albans. And whilst that might mean having to travel to the St Albans site, it does mean that all the services will be located in one place at one time and be critically adjacent to a new theatre complex, which will allow us to offer an enhanced surgical pathway. Orthopaedics and spinal surgery will continue to develop around the new orthopaedic centre that opened in St Albans at the tail end of 2020, really. This will allow us to concentrate all elective orthopaedics in one site. The availability, as Ben has mentioned, of a diagnostic centre with MRI will allow us to undertake different range of surgeries that are currently located in Watford on the St Albans site. The plan with respect to fracture clinic and orthopaedics is to maintain that on the Watford site, keeping its location adjacent to all of the emergency and acute services that will run through that site. The plan for a urology outpatients department will help it to develop close links with the new endoscopy centre there, but also to develop links with other cancer services which may be necessary for those patients which present with urological conditions. We will soon undertake a service review for certain specialties, particularly ophthalmology and oral surgery, and align that with the long-term plan with the commissioners and also for the NHS. Next slide, please. So the general improvements will be that we would have 6 operating theatres. We currently have 5 operating theatres and a procedure room, and there may be a long-term review as to whether we may maintain the procedure room. We will be able to, therefore, if we did do that, increase our minor procedure capacity across the site. All of the surgical teams would be located on this site. And that would allow greater interaction between specialties, particularly with respect to cancer services. And the access to both MRI and CT scan on site would be necessary, not just for the outpatient journey, but also to allow us, as Ben gave an example with spinal surgery, to undertake more complex spinal surgery of the neck on the St Albans site. We would look to and have a more streamlined pre-operative assessment process, and there will be a new admissions and discharge lounge located hopefully close to the theatre complex. Next slide, please. I don't know if Louise wants to take over. Louise has already spoken about how you can get involved. We would welcome people to read our key documents before filling out the survey. And there is a survey available. This site will link you directly into the survey. We'd ask you to engage with and attend these meetings and encourage others to do so. We recognise fully that your views are valid, and this is important for our development to take forward into our development plans. We'd continue to share our news via both the news letters and bulletins that the hospital puts out, and there are options for specific communities to access information in the formats that they require. Next slide, please. And that leads us nicely on to questions, which I think I will hand back to Louise, as she is supposed to be moderating for the rest.
Thank you, and thank you for doing those last few slides for me, Simon. Gave my voice a break, so brilliant. I do have some questions, so I'm very pleased, and keep them coming. So send them via the chat function to West Herts Communications. And the first one I will ask you, Ben, but by all means bring in Simon if you think it's one that's more suited to him. It's about endoscopy. And so the question is, what improvements will there be to endoscopy compared to how it is now at Hemel Hempstead?
Yeah, my understanding around the issues around endoscopy is that the Hemel site isn't suitable for expansion, and endoscopy needs to be expanded. It can't be expanded at Hemel. It can be expanded at St Albans, and like Simon said, co-locating that with cancer services would enable a lot more to be done in one visit on one site, rather than, I mean, just as an example, if you see a clinician in one hospital, you then go to another hospital for your endoscopy, then you come back and see the clinician at the other hospital. That's 3 visits, whereas potentially you could do everything in on one site. I don't know if you've got anything else to add to that, Simon.
Yeah, I think the difficulties that we have with endoscopy at the moment are that it is already split across 2 sites. We do have a nice endoscopy department in the Watford site, and we have a less modern unit, let's say, on the Hemel site. But as you said, the main constraints with the Hemel site are the ability to expand. And so the anticipation is to localize everything in one place with a brand new endoscopy suite that we can tailor to the needs that we identify by consolidating the 2 units.
Thank you. And is there something to say also about, you've already touched on the fact that endoscopy is a procedure that can detect cancer, and so there is something I guess having a cancer site, but also I understand that we would try to provide a information centre and support centre. So for people who are newly diagnosed, there are additional support services at St Albans.
Yeah, I think
which has been one of the considerations.
Yes, the longer term plan, Louise, will be to try and develop as much as possible a one-stop service, so that patients would be able to attend, have the diagnostics that they require, see the consultants they require. They wouldn't be able to have the endoscopy on that day, and that might be a little bit too much for a one-stop service. But they would be able to link into, as you suggested there, additional services such as, say, Macmillan, and have access then to clinical nurse specialists, so that they're not left hanging in limbo, that they can, as much as possible, have their needs addressed on that first visit. They may have to come back, as we said, for an endoscopy or other treatments, but that can all be linked in again then, but having everything concentrated in one site. So we're minimizing the number of visits that people have to make, and we're concentrating the treatment that they can have.
Thank you very much. Can I ask you please about the renovated operating theatres? Would they be up to the same standard as that in a new building? And perhaps, Simon, you could start by answering that question.
Yes, so as it stands, we said we have 5 theatres and a procedure room. 2 of those, one of those theatres is actually a portakabin that's linked on to the main hospital building, and it's wholly unsuitable for certain types of surgery. So anything which has got very heavy equipment or plant that needs to come into the theatre complex, we can't use that theatre for it at all. So the anticipation is that that theatre would actually be taken down, and there's some speculation as to whether or not the new patient admission and discharge lounge goes there. That needs to be worked through with the planners, obviously. The remaining theatres would then be refurbished and upgraded and brought very much into the 21st century. We have actually done that with one of our theatres already. If you were to come and visit, Theatre 4 had a major refurbishment 2 years ago. It had new laminar flow, which is an airflow system that's used in the theatre itself to keep the air supply sterile. The whole theatre was upgraded considerably. And the anticipation would be that that would occur for all the other theatres that exist, which is theatres 1 to 3, and that the new theatres that are made, that are developed on the site, would be up to exactly the same standard.
Thank you very much. And I have a question about one-stop, the one-stop model. So I'm going to come to you, Ben, but there are, I think, some colleagues also joining us this evening, so may also be able to give some information. So could you tell us what kind of one-stop models could be provided at the St Albans site, please?
Yes, certainly. There are a variety of examples. So, for instance, with regards to the hand service within orthopaedics, there is the opportunity to do a one-stop service for certain hand conditions where the patients need a minor procedure that, to all intents and purposes, probably takes about 15 minutes. And at the moment you come in, you have your appointment in one, potentially one hospital. You then get booked in and have that procedure in another hospital, and then you have your follow-up again back in another hospital. Whereas by having an improved, which we've already started the process of with the new orthopaedic unit that opened in last year, and having procedure rooms available, etc., where a patient can come in, be assessed, consented, have their procedure, and go all in the same visit. Because a lot of conditions like that are clear from the outset from the GP referral, and therefore they lend themselves to that sort of thing. For another example, at the moment, patients who have, if you can increase your diagnostic services in one area, you're more likely to be able to come in to your outpatient appointment and have your diagnostic ultrasound done at the same visit, and then get your answer again from the clinician all in one visit, rather than having to have 3 appointments for that.
Thank you very much. I should just say at this point that for any questions about endoscopy, we do actually have a session on Thursday. So if you have particular questions about endoscopy, if you can join us on Thursday at 6 o'clock, that would be a really good opportunity to find out more. Alternatively, if you wait a couple of days, then we will upload that session. So that would be the best way to find out any further information about endoscopy. Simon, I'm going to come to you, if I may, and ask you a question about a theatre that I know at one point we did hire an operating theatre. So the question is, are we still hiring an operating theatre at St Albans?
Okay. The simple answer to that is no, we are not. The hiring of operating theatres, whilst useful in the short term, is not very efficient or useful in the long term. And there's a physical constraint to those theatres. They come of a certain size. They are essentially a lorry that drops a box. And they are exceptionally expensive. And an example of that came around as a consequence of the COVID pandemic, when, as we were coming out of the first wave and beginning to look at the second wave in the future, and wanting to get as much work done as we possibly could to catch up, we looked at the cost of one of these theatres, which was £500,000 for 6 months. The long-term plan should be to develop and improve the theatres within the existing site and have hard theatres on the hospital site. Mobile theatres, whilst useful in some respects for doing things like cataract surgery, for doing minor orthopaedic procedures, are not useful for major surgery on a long-term plan basis.
Thank you for answering that so clearly. I do have a question, and it's another question about endoscopy, and the question is, will this be provided at Hemel Hempstead Hospital? And the plans that we have had in the public domain for some time now have been for that service to move from Hemel Hempstead to St Albans. So that's a question that even I can answer. I am running a little bit short of questions, which is quite unusual. So I just wanted to ask Ben to reflect on some of the discussions that he's had as part of the planning, to think about the service from a patient point of view, patient experience point of view. And maybe you could explain, Ben, what some of the drivers are for these changes, and what, if you could look forward into the future and see the services as we've been talking about, what do you think would be the main benefits for our patients?
So something that's always been a challenge, if you try and do the same thing over 3 sites, there's a danger that none of them are as good as you would wish. Whereas if you consolidate, you can provide I don't want to say all singing, all dancing, but so for instance, if you had a fracture clinic running in all 3 hospitals, it's very, very hard to staff that. You need 3 times the amount of plaster technicians. You need, if anyone's on leave, there's a danger that the service isn't as robust as you'd like. Whereas if you consolidate your services, so by putting, by being on 2 sites rather than 3, you can provide a much more robust consultant-delivered service, which, and from the patient experience point of view, the aim of that is to get the right decision early, the right treatment early, minimise unnecessary visits, minimise unnecessary costs overall to everyone. And that's much easier to achieve on a 2-site model for us than 3.
Thank you. And I think in some ways, Ben, with that answer, you've probably just answered a little bit of a question that's come in to say, well, what's stopping us from doing a lot of this already? Perhaps, Simon, you could answer. I mean, it's clear that we're working towards it. We're not going to flick a switch. We are making improvements, but what's preventing us from implementing this model right now?
Well, the simple answer to that again is nothing, Louise. And the reality is we are actually making changes all the time. And some of these models, some of the things we've alluded to, particularly, for example, with respect to say ophthalmology and urology. Urology, we will need to develop over the course of the next few years, with the urology services spread between 3 sites. They have a small consultant base, but they have a large population base requiring their services. They perform, for example, flexible cystoscopy in St Albans, they perform it in Hemel, they perform it in Watford. They have to send 3 consultants to 3 different places all the time, as Ben has said. Whilst it would mean that patients will have to travel to the service, they can provide a better service by being located critically adjacent to a diagnostic centre, which would yet to be developed. But we are changing the model of the way that we work all the time. And some of these things will occur over a slow period of time whilst the hospital redevelopment is planned. As you said, that's going to take the longest portion of time. And as the new hospital in Watford is built, so that we can't really anticipate having everything in 3 hospitals right up until the day that a new hospital opens. We are going to have to anticipate making slow and progressive changes over a 5-year period so that the services evolve, and that when the new hospital opens, it will open with services that it requires to be in it as an acute site. But as much as possible, we will have tried to upgrade the St Albans site so a new elective centre, if it is, with the diagnostic centre, is ready to go at the same time. But the things are going to happen in evolution.
Thank you very much. I don't have any questions, so we will close in a couple of minutes, but I do just want to take this opportunity to thank you for joining us this evening. Please do have a look at the documents on our website. and do fill in the survey if you haven't already done so. We prefer you to read a few things before you fill it in, but we would be really grateful to have your feedback either way. Keep tuning in if you can at 6 p.m. or look on our website for uploaded sessions. And I'd like to thank you once again, and we hope to have your company at another occasion. Thank you very much.